I have a very special guest with us today, Manon, and we are here to talk about all things related pelvic health and relative energy deficiency in sport. But I'm a little embarrassed to say that I wasn't aware of this place in the world that you are at, this incredibly beautiful island. So would you mind telling us a little bit about you, your PhD, and also where you are in the world?
Hello, Noah, and thank you so much to having me today. So my name is Manon Dauvergne. I'm a physiotherapist, and as you say, I'm specialized in sports and pelvic health. And I'm living in Réunion Island. It's a tiny island, a French island close to Madagascar in the Indian Ocean. So maybe you will hear a little bit some tiny bird just beside me. And right now I'm doing a PhD in sports science. So in the University of La Réunion. And I'm focusing on menstrual cycle and neuromuscular performance in female athletes. So I'm really excited to be here and to talk about this topic with you in your awesome podcast. I really appreciate to listen.
I'm very excited to have you. And honestly, this is a topic that I am not knowledgeable about at all.
Okay.
So I'm very excited to learn from you.
Okay,
So
perfect.
for the first question, and I feel like this rings true for me as well, because I worked in sports medicine for 2 years, but pelvic health I feel like is often overlooked. What's one very common misconception about pelvic health that you wish every athlete or coach or physio knew?
I think one of the most important things to know is any athlete or any person with a pelvic floor can be affected with an issue. A very basic stuff, but everyone has a pelvic floor. And it's not only relevant for postpartum women. And yes, it could be a sport related performance. So if you have one thing to remember is that the truth is pelvic health can affect anyone regardless sex, gender, age, or sport. So yes, it could play a crucial role in stability, especially in pelvic stability relating to hamstring because it's close anatomically. There is a huge role in pressure regulation. So it's really important when we talk about sport like CrossFit, powerlifting, or weightlifting, for example, because bracing is really a huge part of pelvic floor, and it's a technical aspect which is very important in this discipline and in pelvic floor issues. So I think, yes, to be a functional entity, we have to be aware of this. And when pelvic floor is not functioning well, it can lead to symptoms like leaking, heaviness, or pain. And pain in the area, like growing pain, for example. And it's a condition we have a lot in sports medicine, I think. So yes, we have to be aware of that.
Right. Yeah, I feel like when it comes to groin pain and a
Yeah.
power lifter, the first thing that most people would jump to is something like an adductor strain, especially if, like myself, they're not very comfortable assessing the pelvic floor. So therefore, I think there's this almost like this cognitive dissonance, like this bias to stay away from it because you don't know much about it.
Yeah.
So
And I think you say something really interesting. I think it's a little bit shame to talk about pelvic floor in the both side of the story. So for the athlete and for the physio, when you're not a specialist, it's more easy to talk about a muscle injury or an ankle sprain injury more than I'm leaking during a lift sometimes. So yes, it's more easy to ask the question and to say the right answer when you are the athlete.
Definitely. So when it comes to, let's say, a power lifter or some sort of athlete and their performance, how would a pelvic health or pelvic floor dysfunction impact their performance? When it comes to stability, would it be like a reduced force output? Or is it more so about just the fact that they may have leaking and then therefore they're more focused on that during their performance?
Yeah, it's a good question. To help me to respond, I want to talk about the 2023 supplementary material from the EOC consensus, which talk about injury reporting during sport event. And it's led by Isabel Moore and a lot of many brilliant other authors. And they talk about the female specificity of injury. And regarding pelvic health problem, it's not easy to classify them because when you have an ankle sprain or a growing pain, it's an injury. It's easy as a professional to classify that as an injury because people just consulting us because of the problem. And it's really rare that somebody just reporting a leak of urine as an injury. And I really appreciate this paper because they try to change a little bit the narrative regarding the problem of female, especially in this condition, because for a power lifter athlete, which is a female athlete, the leaking is visible generally. If it happens, sometimes we all see the video, which is a little bit impressive in social media of lifter who just leak during deadlift, for example. It's the most common issue and movement. And I think when you see like that, okay, it's not a pain problem, but effectively, it could affect the performance. First of all, for the shame, am I at 100% of my possibility if I think about what is going to happen or maybe happened when I'm currently doing my highest lift, maybe for the gold medal. Maybe the athlete is not at 100% of their mindset to be like, I'm ready to go on. So this is, I think, the most easy way of fixing it. But the other one is related to core canister. And if
what do you call it?
Core canister, core stability, core with pelvic floor, transverse abdominis, multifidus, and diaphragm. So, the can. Yeah, if you are familiar of this narrative, especially in sport-related lifted, when you lift, a lot of people talk about the core canister and the can, like a Coca-Cola can. I don't know if I say it well. You know what I mean?
Yeah, like I guess it's this sort of like these different muscles create this almost canister or like a chamber that the pressure can change within it.
Yes, exactly. So it's all is about intra-abdominal pressure and the way the pelvic floor can adjust to this pressure and the way the athletes are going to do this pressure matter because it's not only take a big breath and do it. It's a little more subtle. And when you have a leak, for me as a pelvic floor physiotherapist, it sounds like, okay, something is going to happen regarding this cylinder of stability, the core canister. And what is it? What is the weakest part of the cylinder? But sometimes it's the pelvic floor, and there is so many. I could talk about it during 1 hour, but it's because of the belt. What is your natural belt? The belt, lifting belt is everything for this sport. So how do you wear it? Is it too tight? Is it too... So there is so many questions about this situation. So
interesting.
Yeah. Sorry, I don't know if I respond
No. So
well.
so how people wear their belt can impact their leaking, and that may be something that you modify to help them leak less.
Because,
that's interesting.
Pelvic floor is one part of your cylinder stability. And in this situation, the main goal is you have to lift the more you can, especially in powerlifting, right?
Yeah.
So it's the aim of the sport. And I will say you can do it whatever you want in the way you want to do it. So if you
Right.
leak, doesn't matter, right?
Yeah.
But it's a misconception because in my world, I try to be more health driven. And to me, if you leak during a lift, something doesn't happen during your lift. Maybe your tension is not equally report in your cylinder because the pressure needs to be all around your canister.
Right.
So when the leak happens, generally something is going to happen with the intra-abdominal pressure. So sometimes people really don't engage their abdominal wall. Sometimes it's too much hair. Sometimes the belt is too tight. So the hair have to go somewhere, and somewhere is sometimes the gravity. So somewhere is a leak. So
Right.
we have to look about all these little things to help people with this kind of issue.
Yeah, it's so interesting. And it's like when I'm lifting, it's not really something that I tend to think of. Do you
Okay.
think people should be thinking about sort of contracting? Because I think many people think about squeezing their belly or sort of, like
Yeah.
sucking in their belly button when they're lifting. Do you think people should also be thinking of pelvic floor cues?
No, I'm not sure. It's not something I do usually because it depends. I think the most important thing is it depends because
Yes.
if you imagine, different layer and the pelvic floor is one of the layer. So your pelvic floor have some capacity, like other muscle, he has his own strength, but having a leak doesn't mean your pelvic floor is weak. Sometimes it's more a problem related to coordination, timing, and synergy, other muscle synergy.
Right.
When your pelvic floor functioning well, he's coordinated with other muscle of your canister. So when you are going to do a task, whatever the task is, you have an anticipatory,
Yep.
your
Yeah.
pelvic floor is going to be a little bit, I'm ready to go.
Right.
And your transversus abdominis is going to be aware too, like we are going to put something in my hand, I'm ready to go on. So the muscle synergy is the key in this situation. And when everything is good and when you are going to lift, normally you don't have to think about. Your pelvic floor is going to go naturally regarding the task. But it depends of what you do with your pressure. If you just push your belly and you don't pay attention to what is going on to your abdominal wall, yes, it could be an issue. But if you are going to create a tension and you are going to do a good bracing, I don't know, maybe I have to
That's the right
describe a
term,
little
bracing.
bit the term, but it's not a Valsalva maneuver. It's something a little bit different. Because Valsalva is a maneuver which is described, especially in pelvic floor area, as take a deep breath, hold on, and push to see what is going on with your pelvic floor. Sometimes it's going to, we use it to see if there is an organ prolapse, a genital organ prolapse. So if you ask somebody to do a Valsalva during a lifting task, but for us in the pelvic floor world, it's something you have to push to bring down. So no, it's absolutely not what we want when you are lifting something. When you lift, we don't want you to push to go down.
Especially if it's causing prolapse, right?
Exactly. And all is about intra-abdominal pressure. If the way you manage your air is going to go down, no, it's not efficient. Because regarding to performance, what we want is create something which is able to translate the forces from the floor to the air. If you do a snatch, for example, if you do a deadlift, create the tension, keep it, and just lift that barbell.
Right.
But if you have a weakness on the way you do the tension, the task.
Mm-hmm.
If you have a weakness like your back is going to round a little bit, it's a week of energy, and
Mm-hmm.
that air need to go somewhere, and the somewhere
Mm.
is sometimes the gravity, and it go to air in the down. So
So that's often when someone may leak, when there's sort of like
yes,
this energy
exactly.
leak in the lift.
Exactly. So
Okay.
sometimes it's and I try to not cue every time about the pelvic floor, because we want that to be automatic. So
Right.
when someone is going to leak during lifting task, we have to see all the layer. So sometimes I don't go to the lifting task. Okay, what is your pelvic floor? Tell me. For you, what is a good contraction? Okay, show me. Okay. Or for you, it's you just take the air and go down. Okay, no, it's not a good contraction. A good contraction is that. Okay. No, let's see and show me how is your bracing. When you're bracing, okay, you do it. It's okay. No, it's not that. When you brace, you're going to push a little bit your abs, like somebody is going to push your belly. So
Yeah.
try to protect yourself. Okay, it's a good bracing. And if I try to help people to be aware where is the air, not down, but try to be like do the pressure
Yeah.
in all around the canister, and not only in the down, and not only against the belt, because a lot of misconception is you have to push against the belt, but you
Sort of
don't
just pushing
create.
your belly button outwards.
Yeah, exactly.
Yeah.
So I try to really, take each layer one by one and see where is the problem is. And sometimes it's because you are lifting and you don't have the mobility to lift in a sumo deadlift, for example, and you try to do it, but you're not able to create the tension and a good bracing in a situation of sumo, for example.
Yep.
So every condition is unique, and I think we have to be aware of the discipline as a sport physiotherapist, and we need to know a little bit the concept of pelvic floor. We want a pelvic floor which is automatic and which is able to contract when other muscle of the canister is going to contract. So an ideal pelvic floor is a pelvic floor which is naturally lifting. When you contract your transversus abdominis, you are going to create the tension to lift the barbell. Everything is going to happen in synergy to do the task.
Yeah. I like how there's maybe an emphasis on cueing it initially if someone has a problem, but then trying to move away from it being so conscious. And this idea that it should be an automatic natural thing, because I think it's just a healthier way to go about life when you're not overanalyzing every move that you make.
Exactly. And
So
if I can add something,
yeah.
the pelvic floor is a taboo topic. So sometimes when we are over cueing this taboo topic, it becomes an obsession. And regarding sport related pelvic floor, I have a lot of women who leak, and they are always contracted because they listen a lot of people who say, just contract. You are leaking? Okay, contract your pelvic floor, contract, and they never relax. So you don't have an efficient contraction, because most of the time they are trying to contract every day, every time, and every task. But it's not the best efficient way to have a healthy pelvic floor. Sometimes you have to relax and you have to trust him. But it's really hard to trust something you don't know, you don't see, you don't understand. And many people, the sport we are talking is really specific. So it concerns not too much people, but regarding the popularity of CrossFit and powerlifter, I don't know in your country, but in mine, it's really popular right now. We have to understand a little bit more what is bracing, what we attend to a pelvic floor, a healthy pelvic floor, how we need to react. But overcuring regarding the pelvic floor is not the solution, the magic solution. Sometimes it's more about relaxing. Okay, show me how you brace. Tell me how you. I say in French, show me how you brace, I told you how your pelvic floor is going to be. If your bracing is just go away and, just push against the belt and let the magic happen, okay, we have something to see
Something to work on.
together.
Right.
Yes.
Yeah. When you say all of this, it reminds me of chronic back pain, where,
Mm,
maybe at first, when people first hurt their back, it really helps them to sort of brace and be stiff and to brace their core. But then some therapists will say, like, that is how you should constantly be because your core is
mm,
weak and you need to squeeze it.
yeah.
And then we see people that for years they've been overprotecting their back. And sometimes for them, the thing that really helps is just a little bit of relaxation.
100%.
Yeah.
It's a really good comparison, I think. And you, as you say, you don't need to brace at every lift, every bubble. Bracing is a technical part of the lift, and the quantity of brace depends of the task. So
And
theoretically,
the intensity of it too, right?
yeah.
Yeah.
Theoretically, we don't need to put a belt before 80% of your max RM. But so many people just use it because it's more easy, because they don't know, because I don't know. And
Right.
you need to train your anatomical belt, which is your abs, your transverses, your multi-feet. And the K is just to understand that and to create a good synergy regarding what you need to be. So
Hmm.
we don't need to be too much aware. You don't need to ignore it, as always. It's
Right, right.
between.
Yeah. And probably person specific as well.
Yeah,
I
yeah.
think it's probably easy for people to imagine that this isn't purely just a mechanical issue because
Mm,
we've used the words, shame
mm-mm,
or embarrassment perhaps if people are leaking, especially,
mm,
in social settings, or just if they don't feel like they have a lot of control over their body, and that could obviously affect
mm,
their mental well-being.
mm,
um and we've also spoken about sort of maybe over cueing and maybe a hyper vigilance, too much thinking about this issue. So
mm,
it's easy to see that maybe there's some psychosocial elements to this as well. But we've also spoken about the pelvic floor in a way where it's very, very mechanical,
mm,
right? Where we're talking about the muscle synergy,
mm,
overactivity, underactivity. How may someone suffer from a pelvic floor issue in a way that is perhaps less mechanical? Is that
mm.
possible?
Yeah. If you are okay, I will just describe a little bit the different condition uh, who can occur regarding pelvic floor dysfunction.
Mm-hmm.
So the main uh, known, I think, is the leakage. And in pelvic world, we have two type of. The most common is the one we talk about, and it's more mechanical related. It's the stress urinary incontinence. It happens during impact, height intensity like jumping, running, or lifting. And as we say before, it's not only about strength muscle, it's about the timing, it's about the coordination. The pelvic floor muscle have to respond at the right time, the right moment, at the right amount of strength to be efficient. When sometimes when they are not responding at the right time, at the right moment, at the right amount of force, they can't generate enough closure force to manage the urinary to go.
Right.
And it depends of the sudden rise in intra-abdominal pressure, and it can occur none in sport condition like a cough, a sneeze, or laughing.
Mm.
Sometimes it's a sudden rise in intra-abdominal pressure, and sometimes the pelvic floor is not going to respond in the good way. So this condition is classified as stress urinary incontinence. The other side is called urgentory I don't know if I say it good in English.
Urgency?
Urgency, yes. And so the second condition is called urgency, and
Okay.
it's more related to the bladder. And sometimes you can show the word overactive bladder. And this condition is more like, okay, I need to go to the toilet right now. I'm just need, it's now or never, or right now to the floor. If I don't go to the toilet, I do it right now where I am. So
Right.
it's a little bit different from mechanical condition. So if something happens more related to the nervous system, control system, and it's often driven by hormonal stuff. And the coupable, je sais pas comment dire coupable, the hormone who are
the hormone
responsible, yes,
yeah.
the hormone who are responsible for that is estrogens. And
Okay.
women who are in a hypoestrogenic state, like in menopause, they experiment more this kind of urinary problem. Like,
interesting.
Yeah, urgence. So it's another world, another type of problem, another type of re-education. And for the more lucky of us, they have both. They have mechanical problems of timing and everything.
Yeah.
And they have overactive bladder, and they have both together because they try to just squeeze every time. So they are going to involve mechanical problem because they feel they need to go every time.
Right.
You see what I mean? So
Yeah.
most of athletic girls have this mixed, we call that mixed incontinence. And for us as a pelvic floor specialist, we talk a lot. Tell me everything, and what kind of water, not water, but boisson, hydration status, did you reduce your hydration status to go to the gym because you don't want to leak, so you don't hydrate yourself so much? And hypoestrogen state is really frequent in athletes regarding rates, for example.
Right.
We have to connect all the dots together. And it's not easy because if you just look around the pelvic floor specialty, you miss sometimes the mechanical part of the demand of CrossFit class. For example, double under is one of the most classical CrossFit class. So I don't know in your country, but in France, they say, okay, double under time, everybody need to go to the toilet, go right now, and after come back. To me, it's a red flag. If you go there,
really? It's that common? People say that?
Yeah.
Whoa.
So it's just okay. It's a jump rope session. So if a whole girl who need to go to the toilet go and come back, say, okay, we have solution for that.
Yeah, that shouldn't be normalized, I feel like.
Yeah, but it's like a joke because it's common. It become a joke, but
right.
we have a lot to do to just talk normally and to help people to understand what is going on with their body.
Right. I think it's important that there's so much dialogue here because it sounds like if someone has a mixed presentation versus stress urinary incontinence versus more of urgency, a lot of how you differentiate between all of that would come from a subjective exam, would come from a conversation and sort of understanding their life and how their symptoms present, right?
Exactly.
Yeah.
Most of the response you will have is just going it's during the historical part. And it's a brilliant tool which have been created by Silvia Giorgio. I hope I say it well. It's the PFD Sentinel, Pelvic Floor Dysfunction Sentinel. So Silvia Giorgio and collaborator made a tool which is super easy to implement in your practice. It's 5 questions only for the first part of the screening tool. Do you experiment leakage, heaviness, a gas or a stool which is not under your control? Do you have pain in the area? or do you need to go, I missed one, I don't remember the one. Yes. Leaks, urgency, heaviness or pain in this area, it's a red flag, and go to see a specialist physiotherapist to see what is going to happen. And after we will do the assessment. Sometimes we need to go to do an internal assessment to see, is it a pelvic floor who is going to be just always contracted? Or is it a pelvic floor which is weak? We don't know, even we don't assess it. The pelvic floor dysfunction tool, the PFD Sentinel, is an awesome tool to know as a physiotherapist, as a physician, just to screen everybody who have a pain in this area, and it could be very frequent.
Yeah.
To have both conditions, a problem in hamstring, a problem in adductor, and an issue with pelvic floor.
Right. I think that's very, very helpful to know that there's a good screening tool out there for physios to be aware of.
Yeah.
What do you mean by heaviness?
Heaviness is a bulge, someone said.
A bulge. Okay.
If you think it's when you experiment it, you know.
Yeah.
Do you feel there is something inside your legs which is going to fall out?
Yeah.
So, spoiler, it doesn't happen. It's well fixed. But the vaginal wall, for example, is going to go away between the vagina opening. So, like your trousers, like I don't know how to say it in English, but heaviness is a sign of prolapsus.
Right.
If you experiment some heaviness, is something we have to look around as a pelvic floor therapist, because maybe something is not efficient in the way you manage your intra-abdominal pressure. So there is different grade from grade 1 to grade 4, and depending of how away the organ is going to fall, to descend. It's a more correct word, to descend. The grade is higher when the descent is involved.
Is larger.
I think, but there is so many people outside there who can talk about it very more better than me.
That's okay. I mean, that's you taught me what it means.
Okay, perfect. So it's a sign of it's a red flag if you want to know. So having a leakage of urine or of gas is a red flag to see a pelvic floor physiotherapist. And for male especially, if you're not able to keep a gas, you don't want to go outside.
Yeah.
It could be interesting to have a look how your pelvic floor is.
Yeah.
Because sometimes just a joke. Okay, you do resistance training, you take a lot of protein, so okay, it's normal to have gas, and
Right.
But no, it's not normal to have it and to not control it. It's not normal.
Right.
And if you experiment hemorrhoid frequently, maybe we have something to look around how you brace, how you lift, and what do you experiment? Because when you have a penis, you mechanically the weakness of the pelvic floor is not the same than when you have an opening like a vagina. It's just managing of pressure. The outside is more large when you have a woman, and when you have a penis, it's more longer. So you need more challenge to have an issue with leaking urine.
Right. So typically in men, if they have a pelvic floor issue and it comes to some sort of leaking, it would typically be in the form of gas, versus with women, it would typically be with incontinence with urine. But that I would assume that's not, a perfect rule. Like 100% of the time, that's the case. I'm sure it could depend, right?
It could depend, but it's a good piece to remember maybe. But women can experiment gas too, and problem with stool too, because of postpartum issue, for example, on the avulsion of one of the muscle, which is called levator ani, is very frequent after a postpartum for a postpartum athlete, for example, and it's more taboo than urinary leak. So it's the taboo of the taboo is anal incontinence. It's really, really taboo. So yes, maybe it could be helpful to just talk about it, say, okay, we have some specialists we can help with, and just please don't stop sport. Because sometimes, and it's hard to me to understand, to listen that, because, okay, we know physical activity is have so many benefits for individual. And when you say to somebody, don't go to the gym because you have urinary leak or gas something issue, you are really going to reduce the quality of life of this person later. So right now it's something which is, okay, she's or he's not comfortable with this condition, but we have a way to fix it as a pelvic floor therapist, and we have to try to keep this person engaging in physical activity, because things is going to be worse if they stop. But we need to clarify how they manage their intra-abdominal pressure. Sure.
Yeah, there's so many parallels, it feels like, to other MSK conditions where people have an issue, so then they avoid the thing that causes it, and then things can spiral. It's like the fear avoidance cycle, right?
Exactly.
Yeah. Can we talk about pain a little bit? Like, why would these things be painful? And I feel bad asking that, because I know pain is a little bit complex sometimes, but why would a pelvic floor dysfunction be painful?
In the condition when pelvic floor never relax, pain is a condition, especially during activity with penetration for a female, for example. So yes, it's a condition we need to be aware, because, as you say, it could become chronic. So the people is going to experiment fear of doing the activity which cause pain. So she can feel not really good with herself, with the body, the people with the person with she's going to
partner.
experiment. Yes, exactly. So it's a spiral after. And if their experiments leak, they contract to avoid to leak, but they create more tension. The tension is going to create pain and fear and anxiety, and she contracts, and you see? And it's, I don't know if I respond well, but in this condition, the pain for us is going to take a huge part of the psychological aspect. And in this area, it could be many things, like endometriosis. So we need to do a differential diagnosis. Is it right?
Differential diagnosis for endometriosis. Yes.
For example, and for other musculoskeletal condition. So it's a huge area. I don't know if I could respond well to that.
No,
but
you did. Yeah. There's a lot of things that could be causing the pain, but if it is like the mechanical issue, a lot of the time it's due to that sort of that overactivity. They're constantly bracing, similar, I suppose, to if people get a lot of pain from back pain, and it's related to so much tension.
Exactly. And for in postpartum care, there is so many. Wow. I remember two patients. One who had an hysterectomy, and she have big pain in the adductor. And after a year of treatment, she's going to see a pelvic floor therapist, and she never relaxed, and she has so much pain just during the assessment. Say, okay, we will find a way to reduce that. And treating pain is an area, a huge area. How can you do that in 1 year, 1 hour in a podcast? I don't know. But we have to be aware, because especially in this area, the consequences of pain is really, really, really emotional, because this part is really intimate. It's hidden, it's taboo. And when people are going to ask for help, sometimes it's been a while they're suffering in silence. So we have to be mindful of that. But
absolutely.
I think I'm not the best person to talk about pain in pelvic floor, because it's really, wow. an ocean of everything.
Right. There's a lot going on. But yeah, I
Yeah.
could appreciate how people want to keep this in. They don't want to talk about it. But if it's, if maybe, for example, like affecting their sex life and then their relationship with their partner, things can sort of spiral, and then they're coming to you after they've been dealing with the issue for so long.
Yeah.
So I guess it's really important that, we're having these sorts of conversations and making it less of a taboo topic so that people will feel inclined to speak about it earlier.
Clearly.
Yeah.
And we have many ways to help with that.
Mm-hmm. Yeah.
And it's not, the internal assessment is not the panacea. We can do with or without that. So if it's a fear, I don't want we touch this part of the body, okay, we don't touch it. It's okay. But let me help you to be aware of what is it, what it looks like, and what we are waiting from this part of your body, and try to reconnect with this part. So
yeah. So let's talk about maybe the internal exam for a second. Just briefly. Like we don't need to go into so much detail, but just so that maybe a therapist like myself who doesn't specialize in the pelvic floor, just so they're aware of what the purpose of it is, so that we could explain that to a patient.
It's not obligatory. It could be helpful to understand in which state is the pelvic floor. As I say before, an athletic pelvic floor sometimes could be, it's not the right term physiologically parlant, but overactive. He doesn't relax very well and very often. And there is two conditions very different and they are going to lead the radiation totally differently. If you have a pelvic floor who never relax, or a pelvic floor which is not able to contract correctly in all the way, in the range of motion, in all the range of motion he needed to. So really two different states, and the internal assessment to me is going to help me to understand what kind of pelvic floor I have inside of me. It's without an internal assessment, we have some cue, we can recollecting some piece of the puzzle to say, I think it's more a non-relaxed pelvic floor or a weak pelvic floor, but we are never sure at 100%. So it's sometimes when the people are not really comfortable, don't want to say, okay, I can do 50%, 60% of my medication. But if I don't know this piece, I always have a missing piece.
Right.
So it's helpful to have a good assessment, I think. In certain conditions, especially in postpartum condition, you can have some tears at a certain place, so we can work on these tears. And when you have some pain in certain situations, the internal assessment is not an assessment. It's we can do a massage or some tissue technique to reduce some pain condition. So the internal assessment is an important piece. And I think we need to clarify this. It's not, I don't do it every time. I do it because sometimes it helps me to understand what kind of pelvic floor I have in front of me.
Yeah.
But if the person is not ready to, I will try to have the response with we try to make a changement in the symptom. Yeah. So you try an hypothesis, you try some a way of rehabilitation, and you see if you are going to improve the person or not. And sometimes we can.
That makes sense. It sounds like you want to do the internal exam to either confirm your suspicion that you have maybe an overactive pelvic floor or one that can't function properly from a contraction standpoint. And then if you can't do your internal exam, then you can maybe just go with whatever you're more suspicious of and try and treat it that way. And then if it responds, then maybe you don't need to do the internal exam, because sort of the treatment effect that you're getting helps to confirm your initial suspicion.
Exactly. And the missing part, when you think about the different layer of the body, Pelvic
Yeah.
floor is more inside. And after you have the core canister, and after you have the friends of the pelvic floor, like hip muscle, abdominal wall, like external oblique, internal oblique. I don't know. I don't remember the big one in English. Le
Rectus
droit de l'abdomen,
abdominis.
rectus abdominis,
Yeah,
yes.
yeah.
And
Anatomy lesson.
exactly. So after it's a third layer, and after you have all the synergic muscle we can apply in a sport-related movement or a movement in general. So when you just have the response of the deepest layer, okay, but let's see the second one, like the core canister with transverse abdominis, multifidus, and how is the breathing? Is the person able to take a deep breath, have a lateral expansion of the costal ribs, of the ribs? Are they able or not? So sometimes, okay, I don't have access to the deepest layer, okay, but I have the second one. And if the second one looks good, okay, let's see the third one. Okay, everything looks good. Sorry, but I really need to understand what is the
Right.
deepest layer. But
Yeah.
for many conditions, you have a lot of cue in the external layer. Like, okay, you don't know how to perform a drawing. Okay, Adim maneuver, to just try to, I don't know how
Is
to
this
say in
like
English.
the cue that people say, like, imagine you're sucking up a blueberry? Okay.
What
No?
is that? No, I'm not sure.
People say, like, they say it all the time. It's like the most common cue that I hear, that when people are trying to tell people to contract their pelvic floor muscles, they're saying, like, imagine there's a blueberry there and you're trying to, like, bring it up.
I understand.
Yeah.
Yes, but it's more a cue which is related to the deepest layer, only
Okay.
pelvic floor. But
Yeah.
when you go to the second layer, which is core canister with transversus abdominis, multifidus, and diaphragm. For the transversus abdominis, you can say, okay, try to put yourself in a trousers which is too tight for you, for example.
Right.
So
Right.
stuck your belly in.
Yeah.
For example, it's a cue to see what's happened with your transverse. And I remember a powerlifter athlete, when I do the assessment of pelvic floor, it's one of the strongest pelvic floor I ever test in my life. Really.
Wow.
And they say, okay, so it's not a pelvic floor problem, maybe. So let's see what is going on for the second layer. And I just ask for the transversus abdominis a contraction, a small, gentle one. Okay, just let your belly in. And she never be able to do it. Never. She puts the head on, she lift and squeeze the glutes, and she do many things, but not what I wanted she do. Say, okay, I think we have something here. And for her, the problem was in the second layer, the core canister, and she was not able at all to understand what is a contraction of the transversus abdominis. So for her, the way she managed intra-abdominal pressure was not efficient because one of the muscle was not able to contract in the right time at the right amount of force to help the lifting task, for example.
Right. I see. So interesting. I think we spent more time on stress, or like stress related incontinence, than I thought we would, and not so much urgency, which is okay. But I think, would you be willing on another podcast sometime to talk about relative energy deficiency, how that relates to urgency? Because I feel like if we started talking about that, we would be here
We
for a
never
very
finish.
long time. Yeah.
Yeah, but I'm really shame because I'm not sure I'm the best person for you for this topic. I know so many brilliant people, which is English native, who can speak about that. Christina Prevent, if you don't know her, she's awesome in this topic, and she lives in Canada too.
Okay.
Yeah.
If you would like to connect me with her, I'm happy to talk to her about it, because I find
don't know.
it so interesting.
Okay, but I hope it will be. I hope it will be good for you for your podcast. But I think this girl is awesome for mechanical part and bracing, Vasalva, postpartum athlete. She's awesome. But I don't know her personally. I don't know if I can connect, but I can share this contact.
Yeah, I'll reach
And
out to her then.
if you want to program another one just to talk about reds, with pleasure.
Yeah, I'd love to. Okay. Well, that was excellent. I learned so much. So thank you so
Okay.
much for coming on. I think it'll be incredibly helpful
Okay.
for a lot of people. I think the majority of the people that listen to this podcast are not pelvic health therapists,
Okay.
but I think after today's conversation, I feel so much better about sort
Okay.
of asking questions to my patients and
Okay.
screening for this and sort of understanding what to look for a little bit more. So thank you
Okay.
so much.
Appreciate. I hope it would be helpful.
Where can people find you if they want to reach out to you or follow you?
You can find me on social media, especially in Instagram, which my name is Manon.Dauvergne, which is my name and my surname.
Cool. I will link all of that in the show notes. Man, I'll thank you so, so much.